Good afternoon. Today is October 2nd, 2020. This is the Falmouth Health Department weekly COVID-19 update. You can reach the Health Department at 508-495-7485. Our email is health@falmouthma.gov, and the website for this presentation and for COVID-related links and so forth is falmouthmass.us is the town's website. So as of today, we have 273 cases of COVID-19 since the beginning of March 19th when our first case came to us. These are all PCR viral tests. Okay, there have been 13 confirmed cases between the 18th of September and October 2nd, which is last 14, 15 days. Tests are locally obtained. The cases are local. A couple of out of the area, but Falmouth residents acquired, and there's been an increase in asymptomatic positives. And that's primarily been from, if you're going in for a procedure at the hospital, you need to have a COVID test, and we're getting some asymptomatic positives among those. It could be that the test might be a false positive or somebody is asymptomatic. So there's been a few of those, a few locals, and a couple out of the area. And I'll talk about it a little bit more of that in a minute. About 95% or so of the cases are no longer in isolation. We're still about 15% of all cases in Barnstable County, with 14% of the population. And of course, the VNA and the CTC at the state, with our support, the health department continue to do the contact tracing as we have since the beginning. Falmouth weekly case trend, as you can see, since about early June, we've been averaging for most weeks less than 10. But the last 5 weeks, we've been in that 5 to 10 rather than the less than 5. So when we see the slide in a few slides, we'll talk about the amount of testing. We're testing really heavy in Falmouth, so that tends to lend itself to a few extra cases by the amount of testing. But that being said, we're sort of in the same trend we have been since early June, around that 5 plus or minus as far as the number of cases on a weekly basis. Weekly case trend continues on. As far as our average incident daily rate, the state every Wednesday comes out with the color-coded chart to tell whether we're in the gray, green, yellow, or red. Gray meaning less than 5 cases over the total of 14 days. Green means less than 4 cases per 100,000, which is for us about 1.3 cases per day or less. Yellow is between 4 and 8 cases per 100,000, and red is greater than 8 cases. As you can see, Nantucket's had a lot of cases over the last several weeks. I think it comes to a church event, I believe is what I've heard about that. That's really been the main cusp of all that happening. You can see New Bedford as well. So most of the Upper Cape, or all of the Upper Cape this week, is in the green, which is still considered low risk. So green and gray are low risk. Moderate risk would be yellow. Red would be high risk. There are more red municipalities in this chart. You can see in the North Shore especially, up through the Haverhill area and up around Boston and the North Shore. Worcester and Springfield as well. So going on to what Falmouth did for the week, you can see I've given you up at the top the last 7 or so weeks for what our case count and our percent positivity is. So you can see we've been for the last 4 weeks above 2 per 100,000. Our best 2 weeks were in the late August, early September, where we had less than 5 cases over 2 weeks. We've been in that sort of no change, sort of in the same for the last 4, around that 2.3, 2.7, 2.5 per 100,000. But if you notice on 10/1, this past week, we did over 2,000 tests in Falmouth over the 14 days. So that's 1,000 tests per week. Again, the more you test, the more you generally would find. So, we're really being robust in our testing. Our percent positivity remains below 1, which is good. It's 0.75. It's been, the highest it was 0.83 last week. We're at the 0.75%. So that's 7.5 positive tests per 1,000. That is less than 1% of all tests are coming back positive. Barnstable County is 2.6 average incidence rate per 100,000. With its percent positivity over the last 14 days of 0.92, we've been slightly less than that. The state has got a 5.7 per 100,000 rate for the last 14 days and a positivity rate of 0.87. So this is pretty similar to last week, the week before, and the week before that. If you look at our testing rate, we're testing higher. We've tested higher, I think, this past couple of weeks than any other town on the Cape. Percent positivity has been a bit higher in all the towns, and so you see the darker colored purple color, which indicates that cases are slightly higher, not at a point where we'd be yellow or red for most of our towns, but they are slightly higher. If you look at the county cases by day, we had the best times at the late August. And then again in September at the 0, you see the 0s, the 1s, the 2s, and 3s. We've been averaging between 5 and 10 per day in the county now, so for the last week or two. And so that's kind of where we are with that. The deaths have been the same for the past week, 174. I don't think that's changed this week. Barnstable's cases today, this is the county dashboard for Thursday, was 13. You see other counties such as Middlesex, Suffolk, and Essex are on much more of a rise than we are. The number of cases for the day was 708, which is the highest number I've seen in a while. If you look at the deaths, you see 0. I think, like I said before, Barnstable has been at 0 now for about a week. The daily dashboard that comes up about 4 o'clock every day from the state's DPH website. The highest number I've seen in a while is 708. We were in that 400, 2 to 400 range for a while. Deaths is 23. Total deaths are 9,265. We're still averaging between 15 and 20,000 tests per day, with over 4 million tests administered since the beginning. And these would be PCR tests, the ones that actually detect viral load. The actual presence of the virus. Our status, the negative trend, positive trend, and in progress remain the same from last week and weeks before that. The death rate, or a number of individuals who die from COVID, is still in the yellow, has not been in green since they've started to do this, and healthcare system readiness as well. If you look at the trends, one of the things I've said in a lot of these talks is the percent positivity, or the average positive molecular test rate. The 0.8, we were doing really well at 0.8. We've jumped over the last several days to 1.1. I'd like to see that, hopefully that trend continues downward, not upward. We like to bend that curve, so to speak, and get it down below 1. Hospitalizations has also jumped. We were in that sort of low 300s to mid 300s, and then we got into the upper 300s, and now we're into the low to mid 400s. So we're up 45% from our lowest observed value of 302 over the last, since, they go back as far back as they go. Surge capacity is up this week. Hospitalizations go up, surge capacity will go up. The average deaths, we were down, in that sort of 10 range earlier in September. We jumped into the teens. Now we're into solid, between 15 and 20 over the last few days. So these are all slightly upward trends, which I hope we don't continue statewide. If you look at the hospitalizations, we're at 436, which is up 61 from last week's presentation. That's a lot. Cape Cod Hospital is up, and Falmouth Hospital is up a bit. We've got one in the ICU at both. Cape Cod Hospital's report, that isn't 917, is not accurate. I forgot to change that. That was this is yesterday's data. 5 hospitalized, 3 at Falmouth Hospital. And you can see that the late September numbers have shown an increase of 54, 10, 26, and a drop of -6 and -2. But the overall trend is more hospitalizations statewide. And, Cape Cod Hospital and Falmouth Hospital had done really well pretty much the whole summer at 0 and 1s, maybe a 2 here and there for hospitalizations. Over the last week or so, we have seen more hospitalizations. If you look at current cases in the ICU statewide, we're up 9 from last week and up 3 for intubation, so that relatively somewhat of an increase, not a big increase, but it's a little bit of an increase. Long-term care, 6,086 of the 9,000 plus deaths have been associated, which is it's been almost the whole time about 65 to 66%. So about 2/3 of all deaths pretty consistently have been out of long-term care facilities. Our assisted living and nursing facilities in Falmouth, there have been a couple of cases associated with employees, but not of patients right now. So those numbers are still accurate. And so we keep monitoring that closely. COVID-19 testing remains the same. Falmouth Hospital by appointment using the call center, 862-5595. Still available at the CVS, the walk-in clinics, the Community Health Center of Cape Cod, and you can go on mass.gov COVID-19 testing to get test centers as well. And all these tests here would be the PCR test that I'll talk about in a second. Just a quick one, I've talked about this before. The PCR is the gold standard, which detects viral DNA. It does take 24, 48, a little bit longer, depending on the amount of tests, the quantity of tests for the labs to handle. And they tell you that you have an active or recent infection. It's checking for the viral RNA, DNA of that actual virus, and that's the only way you'd be considered confirmed. The antigen test, the place in Dennis, the Caremark that does it is still doing it, I believe. There's the only one I know of locally, somewhat locally, which detects antigens, which is a rapid result, but up to a 30% error rating. So if you do test positive with the antigen, it is recommended that you get a PCR test. You would isolate and then get a PCR test. And that's considered a probable. Probable and confirmed cases by us will trigger a contact tracing. Antibody tests are telling you that you have a past infection, that you've had antibodies because you fought it a past infection, and the DPH considers that suspect. In terms of flu shots, your local pharmacies and your physician and pediatrician is still the place to go for flu clinic, for flu shot. We just past Saturday did 570 throughout the countywide test that I had talked about last week. So, you know, we got, let's say, 570 with about 450 of them done in the first 2 hours. So Falmouth is, we're going to host a by appointment only drive-through flu clinic at the Gus Canny on October 26th from 2 to 5. I think the rain date's going to be, we're just working on that right now, would be November 2nd, the following week. Because it's being outside, it's weather dependent. You know, if we had a lot of wind and rain, we can't really have the nurses out there doing a flu clinic. It's going to be at the Gus Canny. You're not going to need to get out of your car. It's going to be available to Falmouth residents 6 months and above. So you would call for an appointment. You can call the health department now for an appointment at the 508-495-7485 if you like. We're going to post this on the website and put it in the enterprise and get the word out as best we can. It's going to be by appointment, and it's going to be in 15-minute blocks. We can do about 20 cars every 15 minutes. So if a husband and wife wants to do it, and you know, you can come to this, obviously in the same car, which helps us with the carpooling. Don't carpool random people because then it's just not good. It doesn't make any sense to do that. But you know, we're going to give you a 15-minute block of time to come and do your shot. Please don't come at the different times because I can't have 100 cars show up at the Gus Canny at once trying to get there for the early. So we're going to give it in 15-minute blocks, and it'll be administered to you in your vehicle. The form is on will be on our website today or Monday. We just finished up the details on this. The consent form needs to be filled out ahead of time. That way the nurses have all the paperwork and the insurance information as you drive up. They just grab that sheet of paper. I'm working on getting it at Town Hall. Don't ignore that where it's going to be. I think we just got to figure out a spot in Town Hall to have some loose ones. If you call, we can also mail it to you. You want to bring your insurance card. Uninsured children 18 and under are eligible for free state vaccine, which we have. And if you're getting the vaccine, you remember to wear short sleeves so that we're not, you know, spending a lot of time trying to get you ready to get your shot while you're in the car. And leave pets at home as well. Some of them are very defensive. If they see you getting a needle, they're going to go attack the nurse. We don't need that. We're doing just the single dose influenza. That's what the VNA orders. They do not order the double dose. For seniors over 65. They feel that the single dose quadrivalent one that's designed to protect against 4 different ones is, the way to go. So the VNA is not ordering that. The VNA does our ordering for our vaccines for us, so they're going to just be doing the single dose. We're not going to be offering a double dose. So if you want to get a flu shot from us, you could call the health department at 495-708-7485, and we'll give you a block of time. Let's say it's 2:45 to 3. You show up between that time frame and get you in, get you out, and you won't need to leave your car. So the details, you're still hammering out 100% of the details on it, but that's the way we're looking to do it, and so, again, you can give us a call. The governor announced that low-risk towns, those are in the green, like us, lower-risk type of communities that are not red in any of the last 3 weeks, can go to Phase 3, Step 2. But for us, what does that mean? Starting October 5th, indoor performance venues will be permitted to open at 50% capacity with a max of 250. Outdoor performance venues will increase by 50% with a max of 250. Arcades and so forth, we'd like to do some increase to 50. Fitting rooms are allowed to be open, and gyms and museums and libraries, flight schools, we don't have any of those, I don't think, is 50%. And revise the gathering orders. The limit for indoor gatherings remains at 25 for all communities. That's where we see the spread happen the most. Outdoor gatherings at private residences in the backyards will remain at a maximum of 50. Outdoor gatherings at venues and public settings will have a limit of 50 people in Step 1 communities, which would be those in the red, and 100 people in Step 2 communities. So if you were at 50 before, with an event you might be having outside, you could go to 100. Anybody who's affected by this that owns a business, wants needs some detail on it, we'll walk you through it if you call the health department. So if this, if you're in this area, and one of the things that they allowed also is self-serve beverages. So, your local convenience stores that had self-serve beverages are allowed. Salad bars and hot bars and buffets still are not. But beverages are. That was one of the other things that changed over the last week. Again, if you have any questions and you see that you've had a change in what your business allows or what's allowed with your business and you're confused, give the health department a call. We'll go through it. Again, social distancing and face coverings is still diligence with that. Hand washing, quarantining upon arrival when you travel, that is still in effect. Avoiding gatherings, parties, especially indoors without social distancing. Staying home and not going to school when ill. That's going to be taken very seriously this year. We can't have our children go with headache, fever, things like that of that nature. We cannot be doing that this year. Following the state guidance, okay? All the businesses follow the state guidance. Call us if you've got any questions. Of course, the health department follows up on complaints, and we have noticed a decline in complaints, so hopefully business in public places, they're doing better. Because, of course, the last thing we want to do is undo the hard work. That's been done. We have seen a slight increase in cases. I mean, we're still in the green, but we still need to keep keep up the fight with social distancing and face coverings. As a recap, the state metrics are on an increase. Falmouth cases remain between 5 and 8 cases a week on average. Our current level in Massachusetts is for Falmouth, because we're still green, would be Phase 3, Step 2, for us being a lower risk community. If you have any questions, give the health department a call, and we'll talk to you next week. Thanks.